In this last video, we're going to talk about ways that drugs affect the nervous system, and we're also going to talk about some examples of nervous system disorders. So first of all, drugs can do a number of things for the nervous system, but the main thing they do is that they're going to have an action on neurotransmitters. So if the drug increases the activity of the central nervous system, we call it a stimulant. But if the drug decreases the activity of the CNS, we call it a depressant. So for example, cocaine is a stimulant. Nicotine is a stimulant, whereas alcohol is actually a depressant. Here are some of the things drugs can do. They can enhance or block the release of a neurotransmitter. A lot of drugs look very similar in chemical nature as neurotransmitters, so they might be able to mimic a neurotransmitter. They might be able to block the receptor of a neurotransmitter, or they might be able to prevent the neurotransmitter from going back up into the neuron that initially secreted it. So let me give you an example. An example of a drug is cocaine. Cocaine is actually derived from a plant, from a shrub. And the way cocaine works is, remember when you have these neurons and one neuron releases dopamine into the synapse, the dopamine binds to the next cell and the person gets a feeling of happiness or pleasure. But after the dopamine is received by the first cell, it goes back. Okay, the dopamine goes back up into the initial cell. But what cocaine does is cocaine prevents the dopamine from going back up into the initial cell. So what happens is the dopamine hangs around in the synapse for a long time. So the person gets this longer feeling of happiness, and they get kind of this rush, this feeling of rush and happiness from this dopamine that's sitting in the synapse for a long period of time. But over time, if a person uses cocaine too much, of course, it's an addictive drug, and the person will become dependent on the cocaine in order to feel any good feeling at all, in order to feel any pleasure. They have to take cocaine. And over time, the person becomes less and less able to secrete this dopamine, and they basically become desensitized to dopamine. So the person never will feel that initial high they felt the first time that they used the drug. They'll never feel that again. And of course, after long-term use of cocaine, the brain becomes less and less active. So here you can see a very active brain, normal and healthy, and a less active brain after years of prolonged cocaine use. Another drug that you might have heard of called meth or crystal meth, more commonly known as methamphetamine. Now, the way methamphetamine works, it actually mimics the structure of dopamine. So you can see here is the structure of methamphetamine. Methamphetamine is closely related to another drug called amphetamine, which is often used to treat ADHD. You can see the only difference is methamphetamine has this extra methyl group right here that's not there on amphetamine. Now dopamine, here's dopamine structure. So you can see dopamine looks a lot like methamphetamine, another very addictive chemical. Now on Blackboard, I put this video here, effects of drugs on the brain. It's a really great video for showing how drugs affect the brain. I highly recommend you watch it. It's only a couple minutes long. Hey, speaking of highly recommended things to watch, do you guys have any recommendations on some shows that I should watch now that we're in quarantine here still? So email me a show or movie recommendation and I'll give you an extra point on your next exam. Oh, and not Tiger King. I already watched it. Now, lastly, let's talk about a few examples of nervous system disorders. Now, these disorders might affect the nervous tissue in the body, peripheral nerves, or they could directly affect the brain or the central nervous system. The first example is MS, or multiple sclerosis. So here's what MS does. MS is an autoimmune disease, which means the person's own immune system attacks itself. Now remember, in your peripheral nervous system, the nerve cells have these myelin sheaths. And remember myelin sheaths allow signals to be transmitted faster through the neuron. In MS, the person's own white blood cells actually attack and target the myelin sheath, and they eat away at it. Okay, so over a long period of time, this myelin is destroyed. Now, sometimes your body can regenerate this myelin and repair some of it, but too much and over a very prolonged period of time, it won't be able to regenerate. So the person may feel any wide range of symptoms, ranging from neurological symptoms. A lot of people with MS have vision problems, pain, okay, trouble with urination. They may shake, may not be able to hold like a cup, okay, due to these long-term damage on the myelin. Now, another disorder, this one directly affects the brain. It's called cerebral palsy. Cerebral palsy starts shortly after birth, so it starts during childhood typically. And usually what happens is the person has damage to the certain areas of the brain, and it usually affects development of limbs. So usually the child is unable to walk on their own. They may have very stiff or weak muscles. They may also have problems with vision, hearing, or swallowing, things like that. Usually what causes this is some kind of trauma to the head during the first few years of life, or maybe some trauma to the head during birth, during delivery. So anything like that might cause this to happen. Alzheimer's disease is another example of a disease that directly affects the brain. It usually doesn't occur until a person is in the middle or their very late years of life. And basically what happens is it causes these abnormal proteins to build up in the brain. These are called plaques or tangles. And these plaques or tangles can cause the brain to become kind of like spongy. So the person will lose memory and eventually lose their ability to do basic things like talk properly, use the bathroom on their own, things like that. Similar to Alzheimer's, there's another disease that directly affects the brain, causes dementia and memory loss, but it's called Huntington's disease. This one is actually a genetic disorder. We know it's a very specifically inherited disorder, and it basically causes early onset dementia. So a person could be even younger than 30 and they already experience similar symptoms as someone with Alzheimer's. Now the last disorder, this one is actually a peripheral nerve disorder, so it doesn't affect the brain or the spinal cord, it affects nerves outside of the CNS. It's called shingles. Now shingles is actually caused by the chickenpox virus. So if you've ever had chickenpox or someone in your family has had chickenpox, they're at risk of potentially someday getting shingles. Now what shingles does is it's the virus, and the virus attacks a nerve cell in a specific area of the body, and usually it's in the back. And so what the person will see is this very characteristic rash. The rash is not the problem. The problem is the severe pain that the person will get in the nerve cell. It'll be extremely painful at the site of the virus.